Hi, and a very good day to Dr. Maria and our fellow classmates. I am Amilin from Group 6 presenting Alzheimer disease. Before I start on our topic, I would like to introduce our team member. Following our sequence in presenting this slide. We, Group 6, consists of me, myself, Anbu Selvam, Hemanandini, Noraini, and Zulhilmi respectively. Starting on our topic, Alzheimer disease is a progressive losing of brain tissue leading to death. This is because the person with AD keep losing their ability to perform basic life functions such as heart rate, fighting infection, and breathing. Alzheimer disease is a main type of dementia that is slowly but surely, since there is no cure once you had it. These are stages of AD that progress from mild to moderate to severe over 10 years plus. We can see how the brain shrink from one area to another until all the brain were affected. It does look like brain atrophy since the brain losing its volume as well as the function. The root cause for AD are still unknown. However, research and study has been started on the abundant presence of amyloid plaque and tangled fiber in the brain of a woman who had mental illness and showing symptoms of memory loss before her death. This finding was done by Dr. Alois Alzheimer in 1906. Early diagnosis of AD is important for both patient and their family for future plan to improve their quality of life. There are some risk factors leading to AD such as age, family history, and genetic related to APOE gene, Down syndrome, gender, head trauma, air pollution, excessive alcohol consumption, poor sleep pattern, and lifelong social engagement. AD cannot be definitely confirmed by one specific method. There are several methods to be done for diagnosing Alzheimer's disease, including non-imaging tests such as medical history review, mental status tests, also physical and neurological exams conducted by specialists for further assessment. Alzheimer's disease is only visible through symptoms for living patients since there is no significant physical change. Therefore, advancement of technology is really a plus. Several technology used to detect AD in living persons are EEG, magnetoencephalogram, CT scan, MRI scan, functional MRI, and the most advanced PET and SPECT scan, which use radioactive substance to help rule out other possible cause for symptom or support an Alzheimer diagnosis. That's all.
Good day to all. My name is Anbu Selvam from Group 6 and I will be discuss about imaging modality of the Alzheimer disease. As we know, Alzheimer disease involves part of the brain that control thought, memory, and language. Alzheimer is evaluated by identifying certain symptoms and ruling out other possible causes of dementia. Usually, doctor will perform a complete medical exam including neurological, blood and brain imaging exams such as CT and MRI. So, the imaging modality that I will choose today is MRI. Magnetic resonance imaging, or called as MRI, uses a powerful magnetic field, radio frequency pulses, and a computer to produce detailed pictures of organs, soft tissues, and virtually all other internal body structures. MRI can detect brain abnormalities associated with mild cognitive impairment (MCI) and can be used to predict which patients with MCI may eventually develop Alzheimer's disease. In the early stages of Alzheimer's disease, an MRI scan of the brain may be normal. In later stages, MRI may show a decrease in the size of different areas of the brain, which mainly will affect the temporal and parietal lobes. So why MRI? As we know, overturning pathology in Alzheimer's disease is only possible in early stages of the disease, and also current diagnostic techniques frequently do not allow for early diagnosis or are prohibitively expensive for routine clinical use. Magnetic resonance imaging (MRI) is the most dynamic, cost-effective, and powerful imaging modality available today, capable of delivering detailed assessment of anatomy, tissue volumes, and tissue state. MRI can detect patients who are at risk of developing dementia in the early stages of pathological change when symptoms are mild. MRI sensitivity not only to gross anatomy but also underlying at the cellular and even molecular scales make it ideal for this task. Second is functional magnetic resonance imaging, or called as fMRI. It will measure brain activity by detecting changes associated with blood flow. This technique relies on the fact that cerebral blood flow and neuronal activation are coupled. When an area of the brain is in use, blood flow to that region also increases. fMRI is widely used to probe the functional integrity of the brain networks, supporting memory and other cognitive domains in aging and early AD. It is non-invasive imaging measures which gives an indirect measures of neuronal activity, infrared from measuring changes in blood oxygen level. fMRI is considered to reflect the integrated synaptic activity of neurons via MRI signal changes because of the changes in blood flow, blood volume, and the blood oxyhemoglobin or deoxyhemoglobin ratio. Acquired during cognitive tasks, typically comparing one condition during the resting state to investigate the functional connectivity within the specific brain networks. fMRI techniques examine the correlation between the intrinsic oscillation or time course of both signal between brain regions, and it is task related, and resting fMRI techniques have the potential to detect early dysfunction related to AD.
Hello everyone, I'm Hema. I'm going to discuss about MRI as an imaging technique in Alzheimer disease. A magnetic field, radio frequency, and a computer can create images of the most internal parts of the body. MRI images of the head can help physicians see any brain abnormalities and can even help them predict who may or may not be at the risk of developing Alzheimer's. In the early stage of Alzheimer's disease, MRI scan of the brain may be normal. In later stages, MRI may show a decrease in the size of different areas of the brain. The 3D imaging for MRIs for Alzheimer's make it easy to spot abnormalities in the brain. These abnormalities can be potential marker of Alzheimer's, but they could also be symptoms of other cognitive condition. The primary role of MRI in the diagnosis of Alzheimer's disease is the assessment of volume change in characteristic location, which can yield a diagnostic accuracy up to 87%. The diagnosis should be made on the basis of two features: mesial temporal lobe atrophy, temporoparietal cortical atrophy. In image 1, we can see the MRI slide of 3D brain illustrating the difference between a healthy control subject and Alzheimer's disease. A zoom view of the image shows an atrophy of the cortical surface involving the hippocampus area that related to the short-term memory formation in Alzheimer's patients. Imaging technique using functional magnetic resonance imaging. Functional magnetic resonance imaging or functional MRI measures brain activity by detecting changes associated with blood flow. This technique relies on the fact that cerebral blood flow and neuronal activation are coupled. Studies have been performed using MRI with echoplanar imaging and signal targeting with attenuation radio frequency in patients with Alzheimer's disease. In Alzheimer's disease, fMRI activation in the hippocampal and prefrontal region is decreased. On fMRI, paradigms activate a larger area of periotemporal association cortex in persons at a high risk of Alzheimer's disease than in others, whereas the entorhinal cortex activation is relatively low in MCI. The techniques are reasonably sensitive and specific in differentiating Alzheimer's disease from changes resulting from normal aging, and studies with pathologic conformations show good sensitivity.
For MRI protocol in dementia, firstly, coronal oblique T1 weighted are used for assessment of medial temporal lobe and hippocampal atrophy. And then, FLAIR image to assess GCA, vascular-wide hyperintensities, and infarction were used. And after that, T2 weighted are used to assess lacunar infarction to detect microbleed in amyloid angiopathy. And lastly, diffusion weighted imaging should be considered as supplemental in rapidly progressive neurodegenerative disorder. For scoring and measurement in MRI, most of it were not reported unless the features have been found useful and reliable. To generate the score, the brain must be viewed in multiple structures involving sagittal plane, coronal plane, and axial plane, and the worst features are used to generate a grade of 0 to 3.
Hi, I'm Siti Nuraini. So I will explain the different type of patient condition in terms of jurisdiction that should be considered for the imaging diagnosis process of radiation exposure, protection, or safety. Okay, first, left all the jewelry at home. Don't bring your jewelry when you come to the appointment of MRI scan process. Just left all the jewelry at home, such as the watch, ring, necklace, earrings, and all the jewelry that contain metal, just left at home, so we don't bring it at the radiation rooms. Second, wear loose and comfortable clothes with no metal on it. Sometimes our clothes have a little bit metal and jewelries, so that our clothes can look so fancy. Next, on the day of the scan, do not use hairspray, hair gel, hairpins, artificial hairpiece, or makeups. And be sure to tell your technologists about your other imaging tests that you have run and where they were done, so the technologists know the history of your medication process, because it will be affect or maybe affect the result of your MRI scan. So here a few important safety information that we must know before we attend the MRI scan appointment. So MRI machine have a powerful magnet, so please don't go into the room with any metal on our body. Second, if you work with the metal, notify your doctor, as a fragment in your eye can damage your vision. So you must tell the doctor if you have any metal on your eyes. Second, the patient with the pacemaker is a very important, because pacemaker is a metal, right? But sometimes we have a pacemaker that can deal with the magnet. So pacemaker are not safe in the MRI. Tell your doctor or technologist if you have one, so we can consult about your pacemaker or how that you must do the MRI scan. Next is, if you have a medication pump, neurostimulator, brain aneurysm clip, artificial heart valve, or cochlear implant, or any implant that you have on your body, please tell your doctor and technologist, so we can do another anesthetic, or we can consult with the technologist.
Besides that, if you are allergic to gadolinium, a type of contrast dye, please inform your provider or technologist so they can find other alternative. This is because you may have kidney problem due to the contrast dye, which led you to a bad side effect.
Parameter for diagnosis the Alzheimer disease. So we are choosing to do MRI imaging, but there's several limitations in this MRI imaging. So the first is the decreased hippocampal volume. So hippocampal is some of the complex brain structure embedded deep into the temporal block. So that means it's have a major learning to the memory to the inside of the patient as well. And it can be increased about 1 to 2% to about the residual of the brain, and it cannot directly detect the histological hallmark, so that means it cannot directly to go at the histological landmark, so as well. And the sensitivity and the specific is approximately about the 90% to predict the decline in dementia. Dementia is some of the part of the disease in the Alzheimer that means is related with the some of the lost memories or lumps of the shortened knowledge of the memories as well, and it commonly having to the some of the folks that means is can memory imagine everything about the side or the time, and the direct observation of the epiplot to NFT are not possible as well, so it can be smart possible to limit all the scans, and it can be a few of the several imaging that we have facing through the MRI. And for the final results, we have some neural damaging in the hippocampus manifest the hippocampal volume, so that means it will increase the hippocampal values as well, and we gonna have generate to the issue for the Alzheimer disease. And basically, MRI is generally not recommended for the serious injured patient. That means the patient with some of the serious brain damaging or the brain structure cause of the impact from the accident. They're gonna be a life support equipment, and then we have to do some of the repair hitting on the MRI images to get the results. And let's go. We have to the comparison with other technique. We have going to FDG PET. That means it's a financial medical clinical diagnosis to neurodegenerative disorders, and it's causing the dementia again. And the dementia is quite a bit challenging for clinical because the category is slices of the imaging that we have some of the tables on the testing methods, and it's gonna be a few other slashes at the imaging that we have for the results. And then for the links, it's about the amyloid PET, and because of the potential major advance in assessment to do the cognitive impairment, and it's gonna be killing the cells. So basically, it's gonna be some of the scars inside the patients. That means we have some of the cells, so it's gonna be giving the some of the sparks of the lights to the patients, and we're gonna be originate for the brain PET scan. So it's gonna be signals, and we have get the result to detect any Alzheimer detection for the patient's disease, and it's gonna be applied on the living people as well. So that's for me, and so we have more research for the Alzheimer disease on the parameter and the technique that we use. So this is a part of it that we are going to do. Okay guys, we have a good time. Thank you.